Appendicitis, early symptoms and treatment. Appendicitis symptoms can vary, but the first sign is often a severe, sudden abdominal pain that starts near the belly button and shifts to the lower right side. This pain can be intensified by movement, deep breaths, coughing, or sneezing. Appendicitis requires immediate medical care, usually starting with antibiotics and intravenous fluids, followed by an appendectomy to remove the appendix and prevent potentially fatal complications like rupture and infection. The symptoms of appendicitis can be uncomfortable, painful, and potentially life-threatening if left untreated. Because of this, it is important to be able to recognize them. Appendicitis can occur at any age but may be more likely to occur in late teens and young adults. This video explains the early symptoms of appendicitis. It also discusses diagnosis, treatment, and recovery from appendicitis. Appendicitis symptoms. The appendix is situated on the right lower side of the abdomen. It is a tube-shaped piece of tissue that is closed at one end. It is attached to the cecum, a pouch-like portion of the colon or large intestine. Sudden appendicitis is the most common cause of acute abdominal pain requiring surgery in the United States, with over 5% of the population developing appendicitis at some point. Severe and sudden abdominal pain is usually the first symptom of appendicitis. The pain often begins near the belly button. As it worsens, it will likely shift to the lower right side of the abdomen. The feeling may become more intense within a few hours and be worsened by moving around, taking deep breaths, coughing, or sneezing. Other symptoms of appendicitis include nausea, vomiting, loss of appetite, constipation or diarrhea, inability to pass gas, low-grade fever, temperature between 99 degree to 102 degree Fahrenheit, chills, stomach swelling, feeling the need to have a bowel movement to relieve discomfort. However, these symptoms appear in only around half of the cases of appendicitis. Some people may experience symptoms such as stomach pain very slightly or not at all. What can be mistaken for appendicitis pain? Abdominal pain can be a symptom of other conditions that can be mistaken for appendicitis. Examples include stomach lesions, constipation, inflammatory bowel diseases, including Crohn's disease and ulcerative colitis, stool parasites or growths that clog the inside of the appendix, damage or injury to the abdomen. Diagnosis of appendicitis. A healthcare professional will normally diagnose appendicitis by reviewing symptoms and performing a physical exam. They may also order some laboratory tests in order to confirm diagnosis. Physical exam. The healthcare professional will most likely perform a physical exam to find out more about the individual's stomach pain. They will typically apply pressure to or touch certain areas of the abdomen. They may also recommend pelvic and rectal exams. Laboratory test. Blood and urine test can help confirm an appendicitis diagnosis or detect signs of other health issues. A healthcare professional may also ask for blood or urine samples to check for pregnancy. If necessary, they may also order imaging tests such as an abdominal ultrasound, MRI scan or CT scan. These imaging tests can show an enlarged or burst appendix, inflammation, a blockage inside the appendix, an abscess. Treatment for appendicitis. Treatment normally begins with antibiotics and intravenous fluids. Some mild cases of appendicitis can be treated completely with antibiotics. The most common next step is surgery, known as an appendectomy. Removing the appendix decreases the risk of it rupturing. Early treatment is important to reduce the risk of complications which can be fatal. There are two types of appendectomy surgery doctors may use. It is important for a person to follow all post-operative instructions from their surgical team. Laparoscopic surgery. Surgeons make several small incisions and use special tools to remove the appendix through them. Benefits of laparoscopic surgery include a lower risk of complications such as hospital-related infections, shorter recovery time. Individuals should limit their physical exercise for the first 3 to 5 days after surgery. Laparotomy surgery. Surgeons remove the appendix through a single incision made in the lower right area of the abdomen. This may be necessary for a burst appendix. It allows the surgeon to clean the inside of the abdomen to prevent infection. Individuals should limit their physical activity for the first 10 to 14 days after a laparotomy surgery. When to see a doctor. Appendicitis can be life-threatening and it requires immediate medical care. It is likely to worsen the longer it is left untreated. Initial symptoms may feel like gas. If over-the-counter medications do not relieve the gas, or if there is severe and worsening pain, the individual should contact a healthcare professional at once. It may be advisable to go straight to the emergency room. Treating appendicitis as soon as symptoms appear will prevent it from worsening and causing further complications. Complications of appendicitis. Delaying treatment can seriously increase the risk of complications. Inflammation can cause the appendix to rupture, sometimes as soon as 48 to 72 hours after the symptoms begin. A rupture can cause bacteria, stool, and air to leak into the abdomen, causing infection and further complications, which can be fatal. Infections that can result from a burst appendix include peritonitis, an inflammation of the lining of the abdomen, or an abscess. Taking pain medications can potentially mask symptoms and delay treatment.